There are lots of things you need to think about when considering a facelift, and I think the key is to think about what you're hoping to get out of it, not what is the right technique or whether a mini or a more invasive technique is the right thing for you. That's something that I or another plastic surgeon will be the judge of, really, after understanding what you're hoping to achieve. And in that, I think it's important to consider your jawline, your neck, the mid-cheek area, to really understand what it is that will give you a result you feel happy with. If you don't have an idea of that, it's then very hard to judge what the right approach for you is. And really, I think if we don't think in those sorts of terms, we may risk going along the wrong tack and making a decision that isn't the right decision or the best decision for you in the long term. In looking into facelifts, you may have come across some facelifts that seem to take an hour and some that seem to take 6 or 7 hours. And the reason is, the range is there because of the huge number of techniques that are involved. So some of the more mini facelifts, the shorter ones, are less invasive. They can pull or lift less, and actually they last a much shorter time. So the mini facelift tends to give you more mini results. And a more comprehensive, more involved facelift that's maybe more technically challenging and has much more to it, whilst it's a bigger operation and perhaps a slightly longer recovery, normally that will give you a more guaranteed effect and hopefully a longer lasting effect too. The type of facelift I recommend really depends on you, and it depends on what you're hoping to achieve. But broadly speaking, if you are someone with very early facial aging, very little change in the neck and just some laxity in the jawline, we can get a good result with a less invasive facelift, possibly under local anaesthetic. Once the jowls become heavier and the neck becomes involved, a more invasive, more involved facelift is needed, often a so-called deep plane facelift, when we're going under the deeper tissues, both of the face and of the neck, in order to release them, to allow them to be pulled up and resuspended in a much higher position. Then that can actually produce a much more natural result. So I think that decision making about what type of facelift for you is the right one comes back to what you're hoping to achieve, and really making sure we make the best decision that you're not going to regret 6 months later or so. A deep plane facelift describes the type of facelift that takes place in a layer of the face known as a SMAS, or below that level. So the SMAS is a soft tissue skeleton we have throughout our face. It tends to be fairly fixed and firm over here, but becomes very much more mobile in this area, which is why we actually get jowls in this area and a lot of sagging here. So for a deep plane facelift, we tend to go underneath the SMAS layer, a border that I've just indicated here, and that allows us to release the SMAS in that deeper plane of the face, that allows that to be mobilized and then lifted up in a more vertical direction, which can really address the jawline and the jowls very nicely, with the addition of further procedures in a similar plane happening in the neck to allow the neck to be rejuvenated a lot and pulled back and up to restore that jawline and that neck chin angle under here. In my opinion, the benefits of a deep plane facelift are that it really releases the tissues that are causing the changes of facial aging the best. There are other techniques where the SMAS can be stitched and lifted in other ways, but because it's not releasing the deeper connections of the SMAS, it is somewhat limited into how effective that change can be. So when we're under that deep plane and we're really releasing those ligaments and the tetherings of that deep plane, that enables us to lift the face very much more easily, more gently, and with less tension on it. And that is what can give such good results from a deep plane approach. The scars from the facelift are designed to be hidden, and they tend to be hidden around the nooks and crannies of the ears. So they come around the sideburn area, they follow either behind the tragus, which is that little bump we all have here, or sometimes in front of it. They go around behind the ear, and then for a variable distance towards the hairline, and sometimes along the edge of the hairline here. And that variation depends on you, your skin quality, how much laxity you have to the skin or skin excess. Those people with much saggier faces and much more loose skin on their neck inevitably will need longer scars to cope with the redundant skin that's produced after the deep tissues are lifted and resupported. Quite often, as part of the facelift process, there'll also be a scar under the chin, a submental scar, and that's there to access the neck, because whilst we can pull quite well from the sides like this, a lot of people require surgery to the center of the neck to do a combination of things. It's to remove some of the deeper fat here, to tighten some of the deeper muscles and sometimes access the glands that can be contributing to the shape of their neck. And also it enables that muscle, the platysma muscle, this muscle, that sheet-like muscle that causes those bands, to be addressed and tightened. And finally, it allows, by the very nature of its surgery, for the skin to have been released over the whole area, which allows us to redrape it, which means put it back in a more favourable position much more easily after that sort of approach. So for people who need or would like a lot of focus on their neck, a submental scar, an under chin scar, is almost a prerequisite. So a hemostatic net describes a whole series of stitches that I tend to place through the skin, directly through the skin that's been lifted up after the face and neck lift, which help to quilt and adhere the skin back down to where I want it to be. And this enables two things. Number one, more accurate placement of that skin so I can put it where I want it to be. And the second is, because it's all stitched down to the deeper surfaces, it really stops the ability for blood to collect. So it really reduces the risk of a hematoma or blood collection, which would in itself require a return back to the operating theatre to be addressed and drained and restitched. These stitches of the hemostatic net are only left in for 48 hours, so they all come out after that. And surprisingly, they relieve no marks. It's amazing that within 2 weeks you can hardly see they've been there at all. And they've transformed my practice, which is why I've incorporated them, because my outcomes are better and my patients, I think, are safer for it. Recovery after a deep plane facelift and neck lift is normally a few weeks. I say to patients I would recommend no social engagements for at least 3 weeks, because certainly for that first few weeks you're going to have swelling, bruising, and you'll feel very, very tight. After that, you should be socially acceptable. I think it's often nice if you can wear your hair down, and you may still want to wear a high neck if there's a little bit of residual bruising. Of course, everything varies between different people, and some people will take a little bit longer to recover, some people a bit sooner. And certainly by 4 to 6 weeks, you should be very comfortable going out and about in social situations. Risks that are specific to facelift surgery include those that can happen at the time of surgery and those that can happen afterwards. So at the time of surgery, one of the concerns we always have is protecting the facial nerve, the nerve that allows us to raise our eyebrows, move our mouth around, because it is exposed and at risk. And sometimes if there's some pulling or bruising of that nerve, there can be some temporary weakness of either the lip or the ability to raise the brow. It's very rare for that nerve to actually be cut and irreversibly damaged. Other risks include bleeding, requiring going back to theatre. Inevitably, there'll be a degree of asymmetry and difference between both sides, as there are on all our faces anyway. There can be fluid collections, such as those called seromas, that may need draining off in the clinic. Infections are surprisingly uncommon with facelifts, and most people's scars settle down very well, but sometimes there can be some lumpiness or unevenness around the scar, maybe behind the ear, that might take some time to settle, and if it doesn't settle, require some minor surgical revision. A Purity Bridge facelift describes a local anaesthetic facelift that we do in the clinic itself. It's perfect for those in the perhaps 40s, early 50s, who are starting to get some early facial aging. It's not designed for people with heaviness to their neck. We perform it with a so-called short scar technique, which means the scar tends not to go very far behind the ear at all. And it involves, similar to a full facelift approach, where we're lifting up the skin. We are manipulating the deep smaz layers to resuspend them with a technique that's specifically chosen for your individual tissues. The beauty of that procedure is that you walk out of the clinic later that day and you recover more quickly from a less invasive procedure. However, it's not for everyone, and the key is to make sure it's the right procedure for you, which is something we could discuss in person when we see each other. So for a Purity Bridge facelift, after going through general consultation process and arranging our surgical date, on the day of surgery, after having something to help relax and calm the nerves, and I then do lots of careful drawings on you. We then spend time putting the local anaesthetic in and give that a chance to work. It is a good idea to give it plenty of time to work before we start the surgery. The surgery is performed through an incision with a scar that will follow the nooks and crannies of the ear. The skin's elevated, the deep tissues, the smaz are then lifted and manipulated into a different position. And finally, the skin's closed after excess skin has been removed, and I will often use a hemostatic net to help secure that skin in a good place and minimize the risk of blood collection. After surgery, And after you're feeling comfortable, you'll be able to leave the practice, and we'll get you back 48 hours later for the first set of stitches to be removed, and other appointments will be arranged for after that. Recovery after a Purity Bridge facelift tends to be quicker than for other types of facelift because it's a less invasive approach. We tend to say that people can get involved in social engagements after a couple of weeks after surgery. Most of the sutures or stitches are out after a week, but there's still a few stitches we leave in for 2 weeks, but they tend to be hidden, such as up in the high area just of the sideburn. So normally people can get back to work and get back to seeing their friends after a couple of weeks, although that does of course vary between different people. A neck lift is a procedure that's performed specifically to focus on the neck more than the lower face or the jowls. It's performed through an incision under the chin and often an additional incision that's around the back of the ears, sometimes encroaching around the front. And we specifically target the neck lift for people with a fullness under their neck, often younger people who haven't yet developed jowls, but it is otherwise incorporated as part of a facelift, which is probably the most common way we use a neck lift. And it enables access to the deeper structures under the neck here, or really, as most people think of it, under the chin, and we can reduce the fullness, tighten the muscles here, and recontour that whole area, giving a better, what we call cervicomental angle, which describes the angle between the chin and the neck. So in neck lift surgery, having made the incision under here, we release the skin. Once the skin is released, we can see the platysma muscle, which is this muscle here. That can then be released, and that exposes a fat pad here, which can then be removed to reduce the volume in the neck. We can then tighten up the digastric muscles, which are muscles deep to that, and if necessary, do some surgery to reduce the glands, the submandibular glands here. Once that surgery is done, we can then tighten up the platysma muscle, which has been released, sometimes releasing it as well to enable a sharper neck contour to be created. And then finally, after stitching the skin here, we might put a hemostatic net in, which layers of stitches across through the skin that stay in for 48 hours to help effectively glue that skin back to its deeper surface. The benefits of adding a neck lift to a facelift is really one of facial harmony. By that I mean, if we've got a nice result and a lifted face and improved jawline, if the neck's not adequately addressed, there's a discrepancy and it doesn't quite look either perhaps as natural, or it can take the shine off or the effect of what would otherwise be a very good result. So certainly for many people, incorporating a neck lift with the facelift will give them the best, most comprehensive result and the most harmonious facial rejuvenation. The salivary glands sit around here in all of us, and sometimes we can actually feel them, sometimes you can see them in people, and in some people they contribute to the contour and fullness in the neck. Now, whether or not we remove part of the salivary glands is a very much individual case-by-case decision, and that involves not only understanding their contribution to the shape of your neck, but also understanding the risks involved, the additional risks in removing them. And that needs to be well thought out, and those risks are principally one of increased risk of bleeding, risk of nerve damage, and risk of salivary leakage forming a collection in the neck. So it's not for everyone, but we would do it when we think it's going to make a significant difference to the neck, and also when we think by not doing it, it might actually have an impact and detract from the overall result.